The UNIC must deploy the most relevant communications tools and collaborate with the most effective partners. And a primary UNIC partner is Caribbean civil society, which we recognize and depend upon as implementers, innovators, service providers, and overall doers of development in the Caribbean. So, over the past few years, we've sought to deepen our engagement and foster more symbiotic partnerships with Caribbean civil society. We've been working toward stronger, more meaningful collaboration by making UNIC's resources and platforms available to civil society to support our shared communications advocacy objectives, particularly those expressed within the rights-based Sustainable Development Goals framework. So for our first activity along this path, the UNIC hosted in 2018 a Solidarity Roundtable with non-governmental organizations in Trinidad and Tobago to celebrate the 70th anniversary of the Universal Declaration of Human Rights. This roundtable was really amazing because it launched for us a new phase in the UNIC's relationship with NGOs and with the rest of civil society, exploring and emphasizing that inextricable link between the protection of all human rights and the sustainability of development efforts and achievements. And for us, it really was a revitalization. It was a revitalized way of working with civil society partners, motivating a proactive, structured, and intentional approach to sustaining a network of civil society allies and adding value to their relationship with the United Nations. So we also took this approach as guidance for supporting Caribbean civil society in its COVID-19 pandemic response. And a good example of this is our Build Back Better Caribbean podcast series, which provides a dedicated platform for civil society organizations to discuss in their own voices how they've identified opportunities to propel recovery from within the very challenges and setbacks created by this pandemic, and how they've used the Sustainable Development Goals framework to support recovery and rebuilding towards a more sustainable, resilient Caribbean future. So the year 2020, in addition to being the year of the pandemic, was also the year that the United Nations marked its 75th anniversary. And it was also the start of the United Nations Decade of Action. So UNIC Caribbean, as part of the UN Strategic Communications Infrastructure, we're focusing on working to ensure that the potency of the mandates produced through these initiatives is not diluted, that the development priorities and needs are translated from words to action, policy, and change. And we firmly believe that the UNIC and our civil society partners must work in tandem to leverage the opportunities created by this disruptive pandemic context. So we've been inspired, and so inspired, we've embarked on a new phase in our partnership with civil society through a focus on inclusion and access, solidarity, and reconstruction with sustainability and human rights at its core. The tangible expression of this new phase is the Sustainability Network of Caribbean Civil Society. And what is it? Virtual spaces and platforms created by the UNIC to facilitate collaborations with our civil society partners, collaborations that are grounded in the protection of human rights and powered by a common commitment to Caribbean sustainability. So to facilitate the kind of collectivity and collaboration that translates into action and impact, the UNIC has used the Slack.com platform to design a virtual meeting space that offers civil society partners opportunities to directly connect with each other and the United Nations. We designed it based on our the conference room at our old offices in Bretton Hall in Port of Spain to facilitate connection and engagement between and among civil society throughout the region, as well as the direct engagement with UN technical experts. So in addition to the spaces for introduction and discussion, which you would have explored in the Slack platform, we've also earmarked space for civil society organizations who want to identify potential collaborators for projects or campaigns, or just want to bounce ideas to get constructive feedback on questions or challenges that they may have. So what are we intending? What do we intend? The UNIC intends with this sustainability network to provide access to information and resources to better understand, navigate, and communicate about the UN system in the Caribbean. We also want to provide access to information and tangible support for the commitment to sustainable development and advancing the promotion and protection of human rights in the Caribbean. And of course, we want to provide opportunities to connect and collaborate with civil society organizations across the Caribbean. A key question that we'd like to answer is, what makes this platform different? What makes this process different? The platform will evolve in response to civil society needs. Your feedback is what will help make it relevant and useful for your work. And this is a process that we've already started to try and prove this concept. Prior to this meeting, you would have been invited to be part of the discussion on Slack to start networking virtually, but also to start unpacking the theme. And it's your thoughts, your suggestions, your recommendations that will make the platform what you need it to be. The UNIC is intending to really try to fulfill its role as a connector, connecting civil society organizations as an important partner with UN experts, and also try to facilitate that individual and collective action that we spoke about in the beginning of the presentation to advance your development work and priorities. So we're asking civil society, yes, to join the network, but not just join the network. We're asking you to engage meaningfully. We're also asking you to constructively critique so that this platform is exactly what you want it to be. And when it gets to that point, we're asking you to champion, to encourage others to join the network. So thank you very much for your attention, and Amanda, I'll switch it back to you.
Okay. I have a question for all of you, not for Lindiane, but for all of you. You have been part of the Slack network, part of this exercise for this meeting has been to join the Slack platform. And I'm interested in knowing about your experience and finding out if there's anything about that experience, whether you've been able, I know there've been a couple comments, but I'd be interested to know whether you're comfortable with it as civil society participants on this platform. How has your experience been? Is there anyone who would like to give a comment on that?
Hi everyone. So obviously, as a digital activist, I'm all about Slack. I do think my experience so far has been exciting. Some of the partners that are already in it, they've been sharing some of their work. Just getting our eyes on what they're doing has been exciting. So I'm really looking forward to how the community will develop, and making use of options such as the booking a room or reserving a space. That seems very interesting for underserved areas as well, such as mental health. So it's very exciting. Congratulations to your team, and happy to be part of it.
Great. Thank you, Maria. Thank you very much. I'm happy to know that you're finding it useful. We're happy to know that you're finding it useful. And we're hoping that each of you is able to take a moment to come to the platform and to see what the other comments are there. We would also invite you, once you've joined, to actually let us know more about your organization as an introduction, so that we know who you are and what your organization is about. Nothing too long, just a short introduction, and that also helps us. It provides an entry um, for us to start the conversation and to dig a little bit, find out more. But I'll ask Lindiane for her comments.
Thanks, Amanda. You took the words out of my mouth. Actually, that was what I was going to add. That we would have tied access to the Slack platform in this instance to participation in this meeting, but be aware that your access to the platform continues after this meeting, because the idea is that the conversation shouldn't end with this meeting. We really took inspiration from our conference room at Bretton Hall. For those of you who've been there, any meeting that we would have, the conversation would start in the corridor, and then it would be explored, interrogated, and so on within the confines of the conference room and within the bounds of the meeting. But it also spill over afterwards, and we want to keep that going, because the idea is that these themes and these issues shouldn't end when the meeting ends, but you have the access to the Slack space to be able to examine and unpack them to your heart's delight, and unpack them with folks who are doing the same work that you're doing throughout the Caribbean. So there's a question, and Amanda, I don't know if you saw the question from Beverly about joining the network. Beverly, if you could just give us a sense of what organization you're from.
Hi, good morning. I'm from Dominica, and I'm from the Achievement Learning Center. I got the email, but I was having difficulty because I think it requested that I have a UN email address, and I really wanted to participate in the discussion, but I was having difficulty accessing. So I couldn't even get to the pre-meetings. So that's basically, but listening to what you're sharing and reading something I really want to be part of, to share what I've been doing and to learn from others who probably are working with similar organizations like I do, because I actually work in special education, where I work with children with disabilities, special education needs, and persons on a whole with disabilities.
Great, Beverly. Let me apologize in advance for the issues that you would have had accessing the platform. What I can do is, after the meeting, I'll work with you directly to make sure that you have the access. And congratulations, you're already part of the network.
Thank you very much.
You would have been part of our pilot group. This pilot group, we would have focused on folks that we would have worked with before, as well as recommendations from our human rights colleagues.
Yes, I know.
Right, to really get this conversation started, but also because it's easier to start with folks that you will be easier on us in terms of forgiving our mistakes and when things don't go so well. So Beverly, I'll participate with you afterwards to make sure that you have the access, and if anybody else has had that experience, please let us know so that we can troubleshoot as quickly as possible.
All right, thank you so much, and good job.
Great, thank you. Tina, I'm seeing you raising your hand. Do you have a comment or question for us?
Just to say, I'm technologically challenged, so I would welcome some coaching so as to make the best use of the whole Slack experience. I think it's great. I'm very happy to be part of it, but I realize that I'm running to catch up because I'm not quite comfortable with managing my phone and my laptop and all the online resources. So I'd be grateful for some help after the meeting.
Great. Okay, Tina, we will communicate with you so we can actually walk through the the platform and the mechanisms of the platform together, and we can ensure that you're comfortable with the platform so you can actually use it and maximize the benefits from it. So great, thanks, Tina. Is there anyone else? Maria, did you want to add something?
No. Hi. No, I just wanted to say that that's definitely true with introducing new platforms, you know. So maybe if we had like a community training for everyone to just understand, or even if you produce a video for us and you just introduce them to what the different rooms are, etc. That's pretty exciting. Me, I'm kind of like a Slack junkie, so I understand all of it. So you know, it's very exciting once you understand how to use the hashtags, how to use the breakout rooms, etc. So I'm looking forward to everyone else learning.
Okay, great, and we'll take that on board, and we'll definitely, develop a tool for learning more about the platform, so we can all use it, in the best way. So thank you. We are going to go live to Facebook at 10:30. So, and you will get a presentation from Reba, who is the human rights advisor in the office of the resident coordinator in Trinidad and Tobago. So she is essentially our line to the Office of the High Commissioner for Human Rights, and any information or material. She and Michelle Brathwaite, whom you will meet later as well. They are both the human rights advisors who have come on board and joined the network. And that's another innovation. That's another step in the strengthening of the network, having the human rights advisors on with us. And at 10:30, you will get a presentation. You'll hear a presentation from Reba about this year's theme and about the theme of human rights and its role in building back better, because part of our reality is the pandemic context and recovery, responding and dealing with life with COVID, but also building back, also recovery and building back better, and exploring how and why human rights is at the core of that process. So Reba will speak about that and take us through that. And of course, we would want you to then get involved and ask your questions and make your comments. But that will begin at 10:30. Excuse me, and Lindian will actually introduce that presentation at that time. So if there are any other questions before we do that, we'll take it now. Or otherwise, we will actually do the countdown to the live feed, which is going to begin precisely at 10:30. But Lindian, did you want to start from now to let us know anything more about the network?
No, I did want to say that I absolutely agree with, and this is what we want. This is the type of feedback that we want. The suggestion of doing a video that can be used afterwards. We can put it on our website and so on, so that folks can see what the platform, the space that we're trying to create, and the introduction of the rooms and how they should be used and that sort of thing. It's really something that we already had on our list, but we really appreciate that type of feedback, because that means that we're making the platform better for you, and we're making access as comfortable for you as possible. And this will help with other folks when they join as well. So other than that, I didn't have anything else to add.
We would also, if you haven't already done so, invite you to like and follow our platforms, because much of the material, virtually all of the material that we share as a UNIC, as a UN Information Center for the Caribbean area, we share through those platforms. Some of you will have received material by email that we send out, information and material from the from our headquarters, as well as on issues related to the United Nations in the region. So we send those out, but the updates on what is happening also come through social media. LinkedIn, Instagram, Facebook, and Twitter. And we would invite you to actually check us out on social media so you can know more about what we're doing, but you can also feel more involved in the work of the unit, because that's the idea behind the network, to actually not relate to each other, you to the UNIC and the UN to civil society as consultants or contacts when we're doing something, but indeed as partners in development and in communications to support development, and in aspiring to and working towards achieving the sustainable development goals, whatever that means in our context, and however we interpret and express that in a way that's relevant for us. In order to make it even more relevant, we need to work together on that. This is the type of partnership we want to create. And if you want to get a more direct sense of the type of work we're doing and the type of material we're sharing, checking out our other platforms is a way to do it.
Good morning, everybody. Today, the UNIC is hosting the first virtual meeting of the Sustainability Network of Caribbean Civil Society that is currently taking place on Teams. This network represents a new phase in our partnership with civil society, focusing on inclusion and access, solidarity, and reconstruction with sustainability and human rights at its core. The tangible expression of this new phase is the Sustainability Network of Caribbean Civil Society. And what is it? Virtual spaces and platforms created by the UNIC to facilitate collaboration with civil society. These collaborations are grounded in the protection of human rights and powered by a common commitment to Caribbean sustainability. So the UNIC is pleased to share with our Facebook audiences the keynote presentation being made by Reba Granado John, National Human Rights Advisor in the Office of the Resident Coordinator in Trinidad and Tobago. Her presentation will be on Building Back Better with Human Rights at the core of the COVID-19 recovery. Over to you, Reba.
Thank you so much, Lindian, for your introduction. Let me just share my presentation. Thank you so much. Thank you so much. I'm happy to be here this morning to present to you on Building Back Better with Human Rights at the core of COVID-19 recovery. First of all, I just wanted to give a brief overview of my presentation and what it's going to be about. So first of all, I'm going to look a little bit at the COVID-19 pandemic. It's gone from public health crisis to human rights crisis. So we want to look at what exactly does that entail, what rights have been mostly affected, what are some of the effects of the COVID-19 pandemic on the enjoyment of our human rights. What has the impact been on vulnerable groups in society? And then we'll take a look at what we mean by putting human rights at the core of the recovery, and what exactly do we mean by building back better. And because this is about the civil society sustainable network, what is the role that civil society can play in building back better? And first of all, now I want to just cue the video on Facebook that we are having. It's just a short message from the UN High Commissioner for Human Rights, Michelle Bachelet. I think it's very useful just to put in context what our presentation will be about today.
The COVID-19 pandemic continues to challenge our societies and ourselves. There are many uncertainties, but we know one thing for sure: we are all in this together. There is a human crisis with human rights dimensions. To address it, we must place people and their rights front and center. Today, the Secretary General released a report that shows how human rights can guide us to build inclusive and effective response and recovery. The priority is to protect people's lives. While the virus does not discriminate, its impacts do. The pandemic is a risk to us all, but has disproportionate effects on the health and livelihoods of some people and communities. Some of the most vulnerable in the face of this crisis are those already at risk, including those with no access to adequate housing or water, and those subjected to discrimination on the basis of their race, gender, or other grounds. It is vital to ensure that no one is left behind. The health of everyone depends on it. It is also important that our responses to the pandemic is open, transparent, and accountable, with the full and informed participation of all. And while emergency measures are helping to contain the spread of the disease, they should be temporary and proportional, protecting people and the rule of law. This is a global crisis. No country can beat this alone. The moment is for international solidarity, cooperation, and collaboration. And when we recover from this pandemic, as we will, we must be better than we were before. Earlier this year, the Secretary General made a call to action to place human rights and dignity at the core of our work, including in time of crisis. His new report gives us concrete steps. By standing up for human rights, we can effectively respond to the crisis of today and build a more resilient and sustainable future. We are in this together. We'll get through this together.
Okay, so basically the message from the High Commissioner for Human Rights just sort of gives us a brief overview about what we're going to be talking about today. So when we talk about human rights, we're talking about those basic rights and freedoms that belong to every person. Human rights are universal, inalienable. Sorry, I have an echo. I don't know if someone's mic is on. Indivisible, interdependent, and interrelated. They are universal because everyone is born with and possesses the same rights, regardless of where they live, gender or race, religious, cultural, or ethnic background. And they're inalienable because people's rights can never be taken away. They're indivisible and interdependent. So all the rights, whether we're talking political, civil, social, cultural, or economic, are equal in importance, and none can be fully enjoyed without the others. Human rights are upheld by the rule of law and strengthened through legitimate claims for duty bearers to be accountable to international standards. So we know the COVID-19 pandemic is a public health crisis. The virus is extremely infectious, and we are seeing, rates of hospitalization go up. We're also seeing a death toll with respect to COVID-19. So because of this, states have had to adopt restrictive measures designed to protect public health and prevent the spread of the virus. These measures, however, have also affected the enjoyment of our human rights. And so today, I just wanted to take a look at a couple of those human rights that have been affected. So first of all, we're going to talk about the right to life. So now the right to life is one of the most fundamental human rights there are. Article 3 of the Universal Declaration of Human Rights states that everyone has the right to life, liberty, and security of person. The right to life is also contained in Article 6 of the International Covenant on Civil and Political Rights, which provides that every human being has the inherent right to life, which is to be protected by law, and no one shall be arbitrarily deprived of his life. So then what exactly is the content of this right to life? The United Nations Human Rights Committee in general comment number 36 indicated that the right to life should not be narrowly interpreted. Individuals are entitled to be free from acts and omissions that are intended or may be expected to cause their unnatural or premature death, as well as to enjoy a life with dignity. State parties have an obligation to take appropriate measures to address the general conditions in society that may give rise to direct threats to life or prevent individuals from enjoying their right to life with dignity. This also extends to the prevalence of life-threatening diseases, right? So the duty to protect life of all also extends to detained individuals. So those individuals in state custody, the state has to make sure that they have necessary medical care and appropriate regular monitoring of their health. So now we've seen that COVID-19 pandemic and COVID-19 virus presents a threat to life, particularly in those with comorbidities and the elderly. So to protect this right to life, states have a duty to do what they can to preserve life. So hence we are seeing lockdown measures happening. We're seeing some countries undertake some mandatory mask legislation just to combat the COVID-19 virus. Because again, states are duty bearers. They have a right to do what they can to preserve life in the face of this pandemic. And if they do not, if the state fails to take at least some minimal steps to protect its population, then it's arguably could be said that, you know, there could be a violation to this right to life for those who may become infected. So that it's extremely important that states uphold these human rights. And I want to go on just to talk a little bit about the right to health. Now, obviously, the right to health is very much linked with the right to life. The right to health is subsumed under Article 12 of the International Covenant on Economic, Social, and Cultural Rights. And this provides that state parties to the covenant recognize the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. So the right to health requires states to take steps for the prevention, treatment, control of epidemic, endemic, occupational, or other diseases. So the COVID-19 virus would fall under this as well. So states have to take steps for prevention and treatment. Also, states have to assure medical service and medical attention in the event of sickness. So the right to health, we're seeing, requires that health goods services are available in adequate numbers. They have to be accessible no matter what your geographical location is, financial status. It has to be non-discriminatory, has to be respectful of gender and medical ethics. So now, how has the right to health been impacted by COVID-19? Well, obviously, in this context, there has been lots of care being taken in terms of overwhelming the health services. So that is what has been the driving force behind a lot of the lockdowns. States are realizing that these the emergency responses to COVID-19 must guard against interruptions to other essential health services. And that includes sexual reproductive health care, includes health services provided to persons living with HIV. States must continue on their immunization campaigns. They must continue on community-based care and supports, including mental health care. So in Trinidad, for example, you would see the Minister of Health has been saying the parallel health system has to continue to work. COVID-19, the objective in managing COVID-19 is to manage the spread and to not overwhelm the healthcare system so that everyone can be able to access the health services. So basically, this is to prevent a situation of, we have this overrun of people being COVID-19 positive, and then I come in an accident, for example, and I would have survived had I gotten the necessary medical attention, but I can't because the hospital is overrun. So this is what states have been doing, and this is a lot of the impetus behind the lockdowns, is to manage the spread of the virus and make sure that the right to health is still accessible. Now, right to education. Now, this one, we've seen it worldwide, how the right to education has been impacted by COVID-19. So this right is articulated in several international human rights documents, most prominently also the Article 26(3) of the Universal Declaration of Human Rights, the Convention of the Child, the International Covenant on Economic, Social, and Cultural Rights. So in terms of setting out what exactly the scope to the right to education, the General Comment in 1999 applied some criteria: availability, accessibility, acceptability, and adaptability. And so we're seeing that come to the forefront now. That comment in 1999 had indicated that functioning institutions and programs must be available in state and also physically and economically accessible for all without discrimination in law and in fact. Acceptability requires that the form and substance, including teaching methods, is relevant, high quality, and adaptable education refers to the education curricula being flexible enough to meet changing needs of societies, communities, and students. So all are interrelated and essential for all forms of education. So now that we've seen the COVID-19 pandemic, we've seen that this has been the largest disruption of education systems, affecting about 1.6 billion learners in more than 190 countries on all continents. So there have been widespread closures of schools and learning spaces. This has impacted roughly 94% of the world's student population and up to 99% in lower and lower middle income countries. So the crisis has exacerbated pre-existing educational disparities. The impact of school closures includes the digital divide. We know that there are children living in communities that may be lower socioeconomic status, rural areas, girls, refugees, migrants, persons with disabilities, forcibly displaced persons. And there is a big divide in terms of this transition from physical school to online learning, in terms of there's sometimes lack of devices and also lack of connectivity. So then this obviously then disadvantages already vulnerable groups of children, and the consequence of that would be learning loss. So learning losses also threaten to extend beyond this generation and erase decades of progress, especially in the areas of women and young women and girls that have been making strides in terms of educational access and retention. Another possible outcome of the school closures and the impact that COVID-19 has had on education could be future dropout rates when physical school restarts. Because of the learning losses, some children may feel like they can't keep up, and that could make them, more frustrated. Also, because of the economic impacts of COVID-19, some parents prefer to have their children employed as opposed to continuing in school in these circumstances. So we just to recap, we're seeing the impacts of the COVID-19 pandemic on a lot of human rights, a lot of essential human rights as well. And I just wanted to sorry, I went to the wrong slide there. So also, I just wanted to talk about the challenge to freedom of movement, because right to freedom of movement is contained in Article 12 of the International Covenant on Civil and Political Rights. And the right to movement indicates that everyone lawfully within the territory of the state should have the right to move, the right to choose his residence, and be free to leave his country, any country, including his own. And so we're seeing that right to movement has been restricted. It's been restricted in terms of border closures, in terms of you can't maybe access some countries. And also there's been an internal restriction on the right to movement in terms of lockdown measures. Now, the freedom of movement is not absolute. There may be restrictions to those, and one of the category of restrictions would be to preserve public health. So that's why you're seeing these restrictions being put in place to preserve public health in the context of a pandemic. Also, what's important to note is that the restrictions to the freedom of movement should only serve the permissible purposes. So they must be necessary, they must be proportionate, and they must be the least intrusive means of achieving the desired result. So controlling the virus and protecting the right to life means breaking the chain of infection. It means that people must stop moving about. It means people must stop interacting with each other as much. And so to do this, states have instituted lockdown measures or stay-at-home measures. And this is a practical and it's a necessary method to stop the virus transmission, to stop, again, as we were talking about, healthcare services from being overwhelmed and thus save lives. However, this challenge to the freedom of movement has had a widespread impact on all other human rights. So the impact of lockdowns in terms of jobs, job losses, livelihoods, access to services, including healthcare, food, water, education, social services, safety at home, adequate standards of living and family life. So then freedom of movement is another one of those rights that kind of facilitate the enjoyment of any other rights. At the beginning, I indicated that, you know, human rights are interconnected, so that we're seeing that the challenges to the freedom of movement has had impact on all other human rights. So the question then becomes, if this is a human rights crisis, what do we mean by putting human rights at the core of the recovery? So I've looked and we've shown how human rights have been impacted by the COVID-19 pandemic. How do we recover? Right. So first of all, to deal with the effects, it is more important now than ever to guarantee basic economic and social rights. There has been widespread unemployment, especially in the informal job sectors. Closure of schools have affected access to education. Women confined to homes without access to social services have been victims of greater level of gender-based violence. So if the focus is not on guaranteeing those rights, then that can also lead to widespread protests, anger within society, and have a destabilizing effect on the country and lead to civil unrest. So in essence, we have to put human rights at the core of the recovery. We have to acknowledge that especially the economic and social rights have an extreme importance to play in terms of recovering from COVID-19. This is a human rights crisis, and measures designed to aid economic recovery have to revolve around human rights. Human rights are interconnected. You cannot separate one specific right to work on. We saw that just now with the freedom of movement, how many rights that affects. So the virus does not discriminate, but its impacts do. So additionally, with respect to the impact of human rights and some of the specific rights identified, what we've also seen is that the discriminatory practices that exist means that some groups are excluded from state protections. So the response to the crisis needs to take into account the multiple and intersecting forms of discrimination and inequalities. We've seen the rise of discrimination, xenophobia, racism, and member states do have a responsibility to counter hate speech and discrimination. We've seen the unequal impact on women. We've seen gender discrimination. Women tend to have higher socioeconomic vulnerability, the rise in domestic violence during lockdowns. Women have also been frontline roles as caregivers, and medical workers, which means that they have a higher risk level. Women have also borne the brunt of unpaid care work. So now that the children are home, now that everyone is home, women have to bear that risk, that burden of taking care of everyone unpaid, while still also doing all of their other work. Racial, ethnic, and religious minorities, it has an unequal impact on them as well. Migrants, refugees, vulnerable to xenophobia, vulnerable to hate speech, loss of jobs, discrimination. And we've also seen that persons with disabilities, they have underlying health conditions. And so that puts them sometimes at a higher risk of contract with respect to COVID-19. And it's important, again, to make sure that they do have the access to services that they would need in the times where everything is changing and things are going things are shutting down, things are not keeping to normal hours, it's really important to ensure that everyone has access to goods and services. So that is just one way in terms of building back better. We have to ensure that there's equality. We have to ensure that there's non-discrimination. We have to ensure, in terms of building back better, that we make a new social contract. We have to put people at the center. We have to focus on reducing inequalities. And when I say building back better, let me just move to the other slide. Sorry. When I say building back better, I mean also it's not enough to, oh, my apologies. It's not enough to, oh my God, what the? Oh, sorry, I'm not sure if you lost my presentation there. Did you lose my presentation there?
Just for a bit, but it's back up now. No worries, Reba.
Okay, great. Right, so when I say building back better, I'm referring to the fact that we can't just go back to what was the status quo in January 2020. We have to build back better. We have to do better, because the inequalities that existed in January 2020 have caused this big impact and this big fallout with respect to COVID-19. So when we're building back better, what we have to do is focus on the Sustainable Development Goals, provide a very accurate map to assist in respect to building back better. So now the Sustainable Development Goals, this kind of has human rights at the center. So when you focus on the Sustainable Development Goals and you focus on those human rights that are contained in the Sustainable Development Goals, that is definitely a way to build back better. Now, the COVID-19 pandemic has definitely had an impact with respect to the progress or the slowing of progress made towards achieving the Sustainable Development Goals and the 2030 agenda. But that contains basically the roadmap that states need to build back better. So need to take account of, where progress may have been lost and where efforts need to be refocused to put the Sustainable Development Goals at the center of building back better, because, as I said, they are very much grounded in human rights. So we're putting economic and social rights at the center in terms of building back better. We're putting the Sustainable Development Goals at the center, and the focus is a new social contract. We need to focus, we need to address inequalities that have existed. And at this point, I think we're seeing the importance of social protection networks. We're seeing the importance of measures like universal health care. So by strengthening social protection networks, by putting human rights to the center, we can build back better. Another way in terms of building back better would be ensuring participation. So there needs to be widespread participation in building back better. And I want to come to the role of civil society in building back better, because this is what it is about. This is what this platform is about talking to civil society. So when I say civil society, that encompasses the third sector, distinct from government and business. The concept of civil society has evolved. It's community-based, faith-based, different organizations, NGOs. And now that we've seen that human rights have to be at the core of the recovery, and you have to put people first, how can civil society play a role in building back better? That's what we're here for today. So generally, civil society has an extremely significant role to play in the protection and promotion of human rights. And all these roles are transferable to the recovery efforts and to the efforts to build back better. First of all, CSOs are involved in community outreach, meaning a lot of times they are the frontline response to providing goods and services to those most in need. So they step in to fill the gaps in essential services to assist those most severely affected. CSOs are on the ground, so they know who needs that assistance the most and who's also not receiving that assistance. So that's an extremely invaluable role that CSOs can play in terms of assisting to build back better. CSOs also assist in disseminating life-saving advice. So although we're seeing the government engaging in public information campaigns, these may not always reach everyone. So civil society organizations have this role to play. They can translate the message into a manner that is more easily understood. They can ensure that the people without access to maybe internet and TV can get the message. And this is extremely important message in the context of a public health emergency. Also in the context of misinformation about COVID, this is essential because there's so much misinformation going on. So civil society can help to disseminate that information, accurate information that the government is trying to get out to the public. So information dissemination is crucial as recovery efforts may see social protection initiatives sometimes not reach the people who need it most. We see that a lot in this country. Sometimes people don't know what are the programs available. They may be programs for assistance and they don't know, or they don't know how to access it. Sometimes they may not know how to apply and they may need some assistance there. So that CSOs play an extremely important role, and all of this helps in building back better. There's been some initiatives with respect to job training, education training. This is the kind of thing that civil society can help bring to the community. Further, CSOs play a crucial role in advocating for the rights of all. So the plans for the recovery efforts must be grounded in full and inclusive participation of civil society. CSOs lend a voice to those who may be left behind, and they play an important role in the contextualization of responses to local circumstances. So what we mean by that is that what may work for one country may not work for another, because there are different vulnerabilities. And civil society organizations are key in terms of identifying some of these vulnerabilities, and they're best placed to be able to form the local context of what's really going on the ground. Plans for recovery efforts must be transparent. They must be clearly communicated and subject to accountability. And again, this is another role that CSOs can play. They can advocate for attention to be given to specific groups. So CSOs can say, you know what, you have this plan for this economic stimulation. Have you considered all the vulnerable groups? Have you considered how this is going to impact this group? How have you considered how you're going to include this group? So it's very important for CSOs at this point to advocate, to be able to review what the plans are. We're hoping, first of all, that they are consulted extensively before any plans are finalized. But even after plans have come out, the advocacy role continues. Also, CSOs have a monitoring role as a type of a watchdog, right? So civil society organization assists in realization of human rights by bringing injustice into the public sphere. Human rights groups have participated directly in the legal process in terms of strategic litigation, and also civil society is key in monitoring what's going on, monitoring the effects of government policies, monitoring the effects of any discriminatory laws. So they have a very important watchdog role to make sure that everything is going ahead as it should in this COVID-19 recovery and based on the recovery efforts and the recovery plans. So civil society is a key player in creating conditions for the realization of human rights. And by putting human rights at the core of the recovery, we can build back better, but we cannot at all build back better without an effective civil society. So then I just wanted to go to my last point, which is how can the Sustainability Network be of value to CSOs in building back better? We've talked a little bit about the Slack platform, and that is just a platform that encourages discourse between civil society organizations, and it can be very useful in organizing efforts where civil society can speak with one amplified voice. For example, we've recently had some issues with respect to gender-based violence. There could be a collective voice of civil society, and not just with respect to those groups whose mandates involve gender equality. So all of this to coordinate the efforts of civil society can translate into strengthened advocacy. It can ensure strong participation of civil society in decision-making of recovery efforts and recovery plans. The Sustainability Network can also allow for networking opportunities that can translate into more collaboration. For example, if one CSO is working on a particular project, they may need some assistance. Another CSO may have just been starting a similar project, and then, you can have that networking and that collaboration to have a wider outreach. And it also allows for me as a human rights advisor and other human rights advisors in the region to see where we can provide any technical assistance where possible to be able to build capacity of CSOs. So it allows for ease of communication between us. If I want to inform in terms of any webinars, funding opportunities. So I do really hope that everyone takes the opportunity to find out some more about the Sustainability Network, find out some more about using the Slack platform, and engage more in terms of CSO's efforts to build back better. Thank you.
Thanks so much, Reba. Thanks very much. And thanks for that endorsement of the Sustainability Network and the Slack platform. Just to round up here, and a couple of quick questions, if you don't mind. You did a really great job, I think, of really highlighting the role that civil society organizations play as first responders, on the front lines, filling in the gaps where necessary, and how vital they are to this, not just the COVID-19 response, but also the recovery, the building back better recovery. And I should let our Facebook audience know that the theme of this first meeting of the first virtual meeting of the Sustainability Network of Caribbean Civil Society is Human Rights for #BetterCaribbean. And we thought it ideal to start with that because of that very fundamental link between protecting human rights and the development efforts. So just to delve a little deeper into the topic, talking about civil society and their approach to human rights, how do you feel what advice can you give them to improve their advocacy efforts? How can they incorporate human rights? Because it is such a very, very important, but also very massive theme. What information or what advice would you give them in terms of incorporating human rights into their advocacy efforts to improve their advocacy?
Okay, I think it's important, first of all, to get a sense of what human rights obligations apply to our country. So first of all, the Universal Human Rights Index, and you can Google it. It's a very useful tool. And then you can search for Trinidad and Tobago or your country, and it tells you what are treaty body recommendations, what are recommendations coming out of the Universal Periodic Review that your country has agreed to, that your country has supported. So that's the first step. We need to find out and frame what are the human rights obligations for a particular country. And I think that's a very good tool that civil society organizations can use. As you can look at your particular thematic mandate and you can see, okay, so for instance, in terms of climate change, the government has committed to these, or these are the recommendations with respect to that. What is the, what have they done thus far? What can we then use this and advocate and say, listen, you've committed to these actions. What exactly is the status of those recommendations and status of the implementation of those recommendations? And I think that's a good starting point. Also, I think in terms of advocacy for civil society, it's important to have that that content background, the knowledge background. It's important to seek out any data. You have to ensure that the evidence you're using to promote a point is relevant, it's objective. So I think it just basically helps CSOs to have that grounding. So you know what you're talking about, you know what exactly the government has agreed to, you know what the human rights obligations look like, and so then you can then use that as a basis to say, okay, these are the obligations, this is what's happening in the country, where have we reached, and then that, I think, is a really good starting point for strengthening advocacy.
Great. And just to touch on the theme of solidarity, because that's one of the anchors of the sustainability network that the UNIC is now promoting as a new phase in our partnership. And you you made it very clear, and we would like to make that clear as well, how important solidarity is. Creating that collective voice. We want to talk a little bit more about that collective voice and why it's so important for civil society, because it's really easy for folks to get very fired up and passionate about things individually, but that collective voice can really help to push things further, from moving things from words and conversations to action.
Yes, definitely. I think one of the sometimes, I guess, weaknesses is that sometimes everybody tends to work in this isolated manner. So, you may be working on this and this is what your focus is on, but the big benefit of having this sort of solidarity network is a bigger voice, an amplified voice. If you're speaking, civil society speaking with one voice in the topic, and it's all these civil society organizations coming together to lend a voice. As I said, it may not be your thematic mandate, but for example, in the instance of gender-based violence, I think everybody can speak on that. So it's about not working in these silos anymore and seeing how best you can assist each other in doing your work, how best you can collaborate in doing your work. For instance, if a particular CSO has a network more in rural areas, and you realize, well, my outreach really hasn't reached some of these rural areas, it's really good to have that kind of connect and that collaboration and solidarity, where you can say, okay, can you put me into contact? I do think, my CSO provides really good goods and services, but we really haven't reached these areas as yet. So I think those are just some of the areas, the interconnecting areas, where stopping working in an isolated manner can really, really benefit. Networks can help CSOs, as I said. You can help in terms of whether it's just sending out. If you see a funding call, it may not be relevant to your particular CSO, but maybe you can just share it to somebody else. If you see any opportunities, and in terms of creating that strong network, so that if, let's just say, particular CSOs have engagement with the government, you can come and take it back to wider CSO network, get wider views, get wider opinions, and more public discourse. I think can only enrich civil society.
Perfect, great. Reba, thank you so very much for joining us. Facebook audience, thank you very much for joining us as well and welcoming us onto your screens. Just a reminder that the Sustainability Network of Caribbean Civil Society is the new phase in the UNIC's partnership with civil society. We're offering virtual meeting spaces and platforms that offer civil society partners opportunities to directly connect with each other, but also directly connect with United Nations experts like Reba. To join the network, feel free to email us at caribbeanoutreach@unic.org or just send us a message on any of our social media platforms. Thank you very much for joining us.
Thank you, Lillian. Thank you, Reba, for helping us to understand how our new regular is a human rights crisis. We're living this reality, but often we don't think about it in terms of human rights. So thank you for that. I appreciate that, and I'm sure that everyone in the community and Facebook, as well, and of course the network that we are creating has learned something. So we want to learn more about what this community has learned, and I'm going to pass over now to hand over now to Michelle Brathwaite. Michelle Brathwaite is with the Office of the High Commissioner for Human Rights. She's the office's regional coordinator for the English-speaking Caribbean. And Michelle is going to lead a discussion because I expect that many of you have questions and ideas and want to be part of this conversation about human rights and about how we move from what is now a human rights crisis to a Caribbean. So I'll hand over to Michelle to take us through that conversation.
Thank you very much, Amanda. And my apologies to everybody that I have to leave you at 11:30, but I sincerely, or 12:30 your time depending, but I sincerely hope that you will continue the conversation for as long as necessary. Again, thanks everybody for joining us for this event. Thank you, Reba, for the very comprehensive discussion regarding, what human rights means in building back better. And I thought that maybe for the next few minutes, we could talk about very specifically what that means in each of your contexts, or at least for those of you who'd like to share. So bear with me as I kind of open with a very loaded question that I hope that your questions, that you would also have follow-up questions to, and we can have a discussion. But, Reba spoke it, and Reba, and you heard the High Commissioner speak in slightly more general terms, right, about what, human rights means in development, what human rights means in building back better. And I thought that maybe what we could discuss for the next few minutes is what are the disparate impacts you are seeing within the communities that you are working with, whether it be in persons with disabilities or LGBTI rights. What are the impacts that you are seeing with your constituency? And what do you think needs to be done to address those desperate impacts? Whether that is, and of course, government has a responsibility, but where do you see your organization in addressing those impacts? And then what kind of support would you need in order to do that? So I know, like I said, it's very loaded, but ultimately, what are we specifically seeing in terms of, we talked about the fact that the crisis doesn't discriminate, but the impacts do. What are the discriminatory impacts that we're seeing? What needs to happen to address those discriminatory impacts? Where your organizations come into play in addressing those impacts, and what kind of support can the UN offer you in so doing? So, with that said, I would like to kind of open the floor to any questions so that we can kind of start the conversation going. Did you have any questions from Reba's presentation, maybe? Or was she really, really, really clear? Well, if no questions are going to start, I'm going to put people. Oh, there we go. I see one hand. I was about to put people on the spot. Okay, go
Renee
ahead.
has a question.
Renee, hello. Go ahead, Renee.
Hi, Michelle. I'm sorry for taking so long to actually raise my hand, but I was not with my mouse working, so I was trying to figure it out. Anyway, with what you just said, Michelle, for us, I should start with, I am representing ECAID, which is Eastern Caribbean Development for Alliance for Equality. I said that wrong, but I'm nervous anyway. We are an umbrella organization, and we work with LGBT organizations in the Eastern Caribbean. And one of the major things that we're seeing, because a lot of our clients and members, you have government, yes, helping families, but you have a population that may have issues within their household. Also, too, when you have government kind of prioritizing, mothers and mothers with children, you have, again, a population that may not fit in that category. So one of our issues have been actually community members not accessing funding, food, and that sort of care package that comes to, a household, a nuclear household. So for us, it's been trying to, it was easier when we had the first situation of COVID, where you had a lot of people coming forward and offering funding. But in this situation now, everybody's pretty exhausted. It's been going on for a year. So it is harder to source funding, It's harder to also get persons back into a situation where they are able to stand economically, work, or those sort of situations. So for us, it has, what I would say is the hardest struggle right now is getting aid to our community. And the second part of that as well is, and this is for everybody, but again, there is a huge mental health situation happening. I find that, you know, our resources are stretched. There's only so many in any of our territories in the Caribbean, only so many psychiatrists, so many counselors, so many you know, social care workers. So you have again an issue of access around healthcare, not just mental health, but I think healthcare in general, but mental health especially, where persons are not able to, like, you may reach out to someone, but you have a session and you're on a waiting list, and then that might not be adequate for you as a person because it may be this month, but then you're not going to see this person in another month. When you are in crisis, you need that sort of intense care at the beginning. So those are the two things, and I don't know if that's really a question. Those are more statements.
No. I mean, like that, but it's feedback and input that is very helpful. Thank you very much, Renee, for speaking up, and that is a really important. The 2 points that you brought up are really important. We've seen most Caribbean countries show some kind of support, you know, along the lines of food and livelihoods and what have you, and you know, the idea that, or the assumption that because you give a household some support or family some support does not necessarily indicate that everybody is going to benefit from that, especially if there are discriminatory dynamics within that household. And then again, the kind of exhaustion of what COVID has brought to all of us, I understand completely, and making it harder to find support and funding, and that is important for us to know. And then mental health, I was asked about mental health not long ago and whether or not we needed to consider how we go about support, you know, because of COVID, what, you know, whether or not we need to think specifically about mental health support. Clearly we do. Clearly we do. Thank you very much, Renee. Tina, I see that you have a question. Please go ahead.
Good day. I just got 2 comments really. You asked for feedback from.
Sure. Yes, absolutely.
Dominica. Our first feedback is that Dominica was smashed by Hurricane Maria in 2017, and so we were just recovering when COVID arrived and has severely inhibited that recovery. The 2 areas that my agency called Lifeline Ministries is particularly very well aware of. One is the increase in gender-based violence experiences, but the lack of data is inhibiting us, giving us a proper advocacy role, that we're fulfilling our role. But we can tell you for sure our referral pathways are blocked, our system is broken, our court hearings are not taking place, people have not been had their day in court or seen justice, survivors are not seeing justice, and very often for self-protection are choosing simply to let it slide, because if you have to wait 5 years to go get through court proceedings, it's a waste of time, and it's just increasing the trauma. That's one area. And the other area where we're really struggling is with families with children, economically struggling for resources, very basic resources, rent and food. When we have a sense of injustice, there's a sense in which people feel that it's who you know gets you assistance. Now, again, we don't have data to show you how many people got what they got by pulling strings, but the people who don't get feel that it's unfair. And so that indicates we don't have an equitable distribution system. We don't have a system where people understand about waiting lists or understand about who takes priority. And so we need some help so that the smaller organizations, we can actually have proper systems. At least we can start with proper systems ourselves of helping people with a waiting system. In other words, the people who are most in need are the ones who should get the most help.
Fair enough.
Thank you.
Thank you very much, Tina, for your input. Your point is very well taken with regard to the increase in GBV that we are hearing about, but that we still lack critical data to truly document and therefore make the case to bring in more resources. Not to mention the fact that in this time of, in the Caribbean region, we already have a problem with data. And now, when it comes to accessing resources, sometimes we need immediate data to do that. And we have that kind of difficulty as well. So thank you for raising that. And as well as the fact that the inequalities in our societies and the privileges that exist among our societies ultimately undermines our belief in our rights system, right? I understand what you're saying, Tina, that there's a perception that you have to know somebody to get some support, which is totally antithetical to what human rights is supposed to be about. People are supposed to take for granted that they have a right to the support that is not necessarily going to come to them because they are poor or what have you. So thank you very much for those comments. I would like to now, I see a number of hands up. So if you just bear with me, I'll say them in the order in which I saw them. Beverly, I see that you had your hand up. Then Arnaldo, Mr. Arnaldo James, and then Denise. So Beverly, please go ahead. Thank you. I think you're still on mute. I think the mute is still engaged. Still seeing the mute engaged. You might have to click on
Okay, I did
that.
that.
There you go.
Hi, good morning. Good morning, Michelle. Thanks. I'm finally seeing a face to the name.
That's right.
My particular areas are actually for children with special education needs and persons with disabilities. And COVID, prior to COVID, we already had our own struggles, but because my center, children with special education needs, they are marginalized. And then for us, we have the center which caters to a very small population, but those some parents choose to send their children in the schools, and it's okay because we really cannot accommodate everybody because of where we were. However, we ourselves got no support from the government, and the parents could not pay their fees, so we were evicted from our building. And then but COVID, I would say, I don't want to say because it might sound kind of almost like a blessing in disguise for us, because we were still very creative and innovative in offering our services to our children. So what we do, we do not have a physical building, but as I always tell people, we are not closed because we are still functioning. So we are offering online to our senior students who are able to navigate the online platform. And then our teachers go to the homes. So we do home visits. So we have students who are skilled because our students have varied needs. So our students who are skilled, so we take them home. The teachers go home, they teach them how to dress. They teach them their fine motor skills. Last week, I was very happy to see my students making a cake. The students couldn't hold a spoon and now they are making a cake. So we have seen success in that area in terms of going to their homes. It is still straining because we cannot afford to pay the teachers, and the teachers have to travel very, very far to go to their homes, and so they have to pay from their own pocket. But because we love what we do and we are passionate, we know we have to reach out to them, we do it. Also, fortunately for us, we do get a lot of support from different partners, and UNICEF really came on board and funded a big project for us. We actually had written a project for a sexual education curriculum, and then COVID hit, so Heather called and asked us to give it a COVID dimension, and then so we kind of changed the project around, and we so far have been able to give out 141 relief packages.
Excellent.
We have been able to do teacher training, so we had, and it really had a regional impact because we had persons from Guyana. So we worked with the Regional Stimulation Center from Guyana. That was Keon Chong. We worked with Naomi White from Barbados from the Early Stimulation Center. And we worked with Nathan Ebanks Foundation from Jamaica, Christine Ebanks. So we did training for our teachers and our parents. And it also provided, and then one of the things it provided was to strengthen the partnership with the Ministry of Education, because in order for UNICEF to actually implement the project, we had to partner. It would be easier to partner with the government. So having worked with the Ministry of Education and having a very good relationship with the Ministry of Education. We partner with the Ministry of Education, who's actually managing the project while we implement it.
Okay.
And then so far we have done the training for the parents. We have done a 5 podcast series. So you can, if you go to YouTube and you look for JL Live, JL Joseph Live, you will see a podcast series which says acceptance, imagining it's you. I'll write it in the chat. And then so we did a podcast series, and we had people with disabilities, we had educators, we had advocates, and we had parents. And they were not just from Dominica, they were also from around the region. So we had Jamaica represented, we had Antigua, we had Barbados. And then so this was one of the things that the UNICEF provided. We are now rolling out our animation series, which is basically an education program. And we are using some of the cartoon characters of our students with disabilities. So you might see some looking like they have Down syndrome, because we realize our students will really better if they have something that looks like them. And hopefully we're going to put up our billboard very soon, which is our awareness, disability inclusion
This
awareness.
as well, and we'll come back to Beverly if we can. Oh, I beg your pardon. Hi, Beverly, you're back. Thank you.
I am back. So yes, so I'm not even sure where you lost me, but I think we are going to we're going to roll out our billboard. So we have an awareness billboard that says, acceptance, imagine it's you, inclusion is in everybody's ability. And then so we have our children doing different activities to show, it's actually, we want to show the community that despite their disabilities, they can do something. Mm-hmm. And we have an animation series, which is just completed. The producer just told me it's completed, so we should be rolling it out. We are launching our website. And and then we had the opportunity now last week, and then hopefully we should be ended by April. We are now also partner with the Ministry of Youth Affairs and Disabilities, and we are using the Kobo data set, and we are trying our best to see how many people with disabilities we can capture, and not just in terms of quantitative data, but also in qualitative data, because as we know sometimes we just have the numbers, but we want to ensure what are their needs and how best, when the government or when the ministry is rolling out social protection programs, that they are captured. And with me, apart from doing this, I've also, and then I'm going to share this network with my Caribbean network, because I'm also the coordinator of a network called Caribbean Disability Leaders. And then so it's just a group of all of us from the Caribbean who just decided to keep busy during and we've been doing quite a lot of work. We covered so much, we did so many activities during Disability Month, and also gender-based violence. We partner with the women programs, and we are now doing our own community profile, our membership profile, to find out who do we have and where they can function properly. So these are some of the things that we have been doing. And then so we look forward for technical support from the UN. I'm really happy for this network, because I think we do not want to replicate, we do not want to be doing everything in our own corner. And I think with that network providing the forum and what is it that we want to do, then that will give us the technical assistance and more information. And we also need to find out where the fundings are available and how we can source the funding, and we can continue, because what I recognize is, as I go out in the community and deliver the packages, sometimes I leave with 60 packages, and then I have to come back and do a second trip, because those I had on my list, there were more there. And then so we are now recognizing there are so many more people out there with these needs, and people are reaching out all the time. They just send email, I just now have an email, somebody wants a wheelchair, somebody wants packages, somebody wants sanitary napkins. So we need to continue. I know the government had this cash transfer. I'm not sure how many people got it, but I think we need to continue, because at the beginning of the pandemic, it was all hot. But right now it's settled, and it seems like they are forgotten, but they already were forgotten before the pandemic. And so we cannot keep them being forgotten all the time. So we need to continue that relief we probably just need to continue that relief, that outreach. And then I look forward to continuing partnership with everybody that's there. And thank you so much, Michelle.
Thank you very much, Beverly. You covered a lot of ground there, and I'm delighted again to hear about some of the ways in which COVID has forced some positive change, right?
Yes.
Positive kinds of adaptations. And also to the way in which the UN can possibly support, both in terms of technical support as well as funding support. So I apologize again that I have to run. Part of the reason I have to run is because I'm trying to get some resources together, actually. But I will leave you in the capable hands of my colleagues. I will certainly hope to maintain contact with the network. So hopefully I'll have another chance to interact with all of you again. So thank you again for allowing me to join you, and good luck with the rest of today's meeting. Thanks so much. Bye-bye.
Goodbye, Michelle. Thank you so much for facilitating that discussion. But we won't end here. There were a couple others. Arnaldo and Denise also had questions. So we'll take those questions and Reba will respond to you. So let's start with Arnaldo. If you can give us your comments, your questions, we will do that. We're just going to go for a couple more minutes, and then we're going to have to wind up by 11:35. But please, go ahead.
Oh, hi. I hope you will.
I can barely hear you, Ronaldo.
I feel like my mic might be giving trouble. If that's the case, are you able to hear me at all?
Yes, I can hear you. It's just really soft. I can hear you. Go ahead.
Okay. So thank you, everyone. Thank you, Beverly, and Samantha, and Helen. So I'm Arnaldo from my project, and I actually wanted to build on something that Rennie from Kid had said, specifically in reference to mental health for my life project. Our focus is improving access to mental health resources in Trinidad and Tobago. And so, amongst one of the things that we developed during this pandemic is this platform called findcarept.com. And so it is a directory of psychosocial services. It's very much focused on Trinidad and Tobago. But part of why we're in this sustainability network is to foster collaboration. And so, like, I'm interested in whether there are projects or whether there is some way that we maybe could collaborate with or assist Kid, because we're also our team is focused on web development and particularly like curation and content distribution. So I'm just throwing that out there. So that was more specifically to Rennie, but again, like, thank you for the UN information and the rest of you for creating this platform.
Okay, thank you, Ronaldo. It was a little bit hard to hear you, but I think you were just asking about any potential collaboration. You guys are working on a directory of psychosocial services. So I think definitely, and I think you were trying to direct that question to somebody else, but I definitely think this is a very good tool and platform to be able to have that kind of collaboration. So it could be something as you say, you just pitch, here's what we're working on this project. Anybody else want to come in? Does anybody else have any connects? So I definitely think the Slack platform could be a very good tool for that. So you could probably log in, start to the Slack platform and just give a little rundown about the projects that you're doing. And if anybody can come in and can have some assistance, anybody can have some feedback there, that would be great. I think we have another question. We're supposed to take Denise. Denise?
Yes, Denise.
Hi, I will try to speak quickly. So I have, can you all hear me?
Yes, I can hear you.
So I have more comments, maybe some questions as well too. So CCHR, we work on refugee and migrants issue, advocating on prison conditions and length of stay and remand. And we do also touch a little bit on police brutality. For us, the challenge with refugees and migrants, for example, COVID restrictions is actually impacted refugees and migrants severely. First of all, the vast majority of refugees and migrants work in the informal sector, so they've been hit hard, high rates of unemployment. And then, of course, pre-COVID, there were only a limited amount of refugee and migrant children that had access to education. And now that is exacerbated as a consequence of COVID. So you now have like a whole generation of children being left behind. And that, of course, will, ultimately affect the development of Trinidad and Tobago if they continue to stay in Trinidad and Tobago. So also immigration detention, well, COVID restrictions, again, border closures, what we've seen is an increase in detention and deportation, and particularly concerning there's still 7 children that were left from the original 16 children that were deported in November and then returned to Trinidad and Tobago. They have a court case pending. And so they've been in detention for a few months now. So that's a particularly urgent situation. CCHR hopes to highlight it soon. And then, of course, another challenge too, as well too, is with respect to rule of law and these challenge to deportation orders. You see inconsistency in application of court decisions, and also there's been disregard of court challenges and violation of their right to due process when these asylum seekers and refugees have challenged the deportation. I'm trying to think. And then what else? I made some notes. Well, let me touch on prisons quickly. So same thing with COVID restrictions, of course, with virtual court and with court closures, et cetera, that has also contributed to already lengthy stay in remand. One of the things that we've discovered through our work is that a lot of these persons in remand, they don't know their rights. They don't know, what recourses available to them, what access they have to state resources. Legal aid is severely under-resourced and very, very limited. A lot of them, remandees, they don't have the resources to pay for legal services, and also some of them that do start off having money deplete their resources, and then they can't afford lawyers. So CCHR, that's where we want to be able to offer legal services, educate them on their rights, what recourses are available with respect to state support. And CCHR ultimately wants to engage in litigation with respect to the refugee and migrant situation and with respect to lengthy stay and remand. So these are areas that we are hoping to to acquire resources and support for.
Thank you so much, Denise. I think it's really important, just providing that context of the refugee and migrants in Trinidad and Tobago. That's a huge population that we need to consider. We need to consider their human rights. We need to consider protection and promotion of their human rights when we're talking about building back better. It's impossible to, as I said, build back better if we're not looking at the most vulnerable groups. And we've seen that COVID-19 has had an extreme impact in terms of employment and education and all of that. So I think we definitely thank you so much for providing that context and just giving us an idea of CCHR's work in that context. And also, I think I just want to highlight again the importance of strategic litigation that you said that CCHR would engage in. That's a big rule for civil society organizations. Because again, you would have the idea of what's happening, who are potentially being, maybe good test cases that we could go ahead with respect to the courts and get decisions that can then have an extremely positive impact for the rights of everyone else. So I think strategic litigation is definitely something that CSOs should engage in more, and I definitely encourage that and look forward to that kind of strategic litigation coming out from CCHR and other CSOs. I'm seeing I have another hand up, Gordon. I think we have to wrap up just now, but if you could be quick, Gordon, we can probably fit you in.
Are you hearing me?
Yes, I'm hearing you.
Okay, I'm concerned. I represent Vision and Mission. It's an NGO started by the deceased Wayne Chance. that looks after the repatriation of deportees and resettlement of inmates, both remand and convicted. And there must be a consistent effort in terms of, if we talk about human rights, those people coming out of prison as well, not only while in prison, but when they come out, they are entitled to certain human rights in terms of work, in terms of accommodation, in terms of helping the family, proper reunification, looking after victims in terms of restitution. So there's a lot of resources that are required, right, to supply that kind of support for those persons coming out of prisons and for those who are being repatriated. And an important country, I think there must be some kind of responsibility to provide some kind of support resources when they are being repatriated. I don't know if in this whole aspect in terms of building a Caribbean society better, that we must take in consideration in terms of how do we resettle. We must have a proper resettlement policy and system to properly resettle our deportees, our returned citizens, and persons coming out of our prison. It called for infrastructure, it called for resources, and it called for services with the right kind of thinking perspective in terms of how do we provide the kind of resources, not only in terms of human rights, but in terms of survival, right? To be a productive citizen when they leave and when they are repatriated. I don't know what kind of resources or what kind of thinking is going at this point from building the Caribbean better, right? To take care of our own.
Yeah, thank you so much for that, Gordon. You know, in terms of a state's responsibilities, we know that they have a big responsibility with respect to those in detention, not just in terms of, as you say, you know, in terms of the COVID-19 and managing and making sure that their health is okay, but also there needs to be talk about what are reintegration plans, what are resettlement plans. It's very, very important facet of human rights and of prisoners' human rights, and also as a society as a whole. I think we have a very you know, we have an interest in making sure that people can get those kind of resources, and they need to start over, and they need to contribute in terms of you know, any efforts that they need in terms of any housing, in terms of employment. I think those are extremely important points that we need to look back. We need to you know, focus on. And also in terms of CSO engagement, as you were saying, you know, government will need to engage with CSOs and find out exactly what are the concerns and what are the areas that need need assistance and support going forward. So thank you so much for your questions. I think at this point, maybe I turn over to Amanda or Lindian for closing.
Thank you, Reba. Thank you for taking the discussion, or helping to wrap it up. I think that was a useful. It was the beginning. It was vibrant, and it was just the beginning, though. It was the beginning of an ongoing conversation that we invite you all to continue. If you weren't able to ask your question or make your comment, then please do use the Slack platform to do that. We've heard you about learning more about the Slack platform, and we will provide the tools, and we will help you to learn more about how you can use it in the best way. So you can exploit that resource, and you can connect more directly with each other and with the UN. That's the objective of this, and we're looking forward to continuing this conversation. We are recording this exchange on this Teams platform, and we will use your input as part of a package that we will post to our YouTube account, so that you can come back to it to hear about it. And you can also share this information about the recording with your other partners, because the idea of networking is to actually extend the network and to benefit from as many voices and ideas as possible. So before we leave, I wanted to thank everyone. I thank you all. Thank you all for heeding the call to actually explore the Slack platform and to join us today and to assess whether what you think about this and how you feel about this networking initiative. So I am very thankful to you, as are all of us at the UNIC and Reba and Michelle in our extended human rights network. Thank you for participating. And I would invite you to activate your video so that we can take a screenshot. Lindian will take a screenshot. So we have not only an audio recording, but a video or a photo recording of this experience, which has been a rich experience and which we look forward to continuing with you. So I invite you all to open up your video so we can see you all, and we'll take a quick photo, a quick screenshot, and then we'll adjourn.
All right, is that everybody? I don't have, Gordon, excellent. So I think that's everybody.
Yes, Renee, Nicole, is everyone who is coming on for the photo here? Tina, there you are. All right. So
okay, so just give me 2 minutes. I'm really excited about this, guys. Give me 2 minutes. Great. I think I got it. Thank you so much. This was great.
Yes. This was wonderful. Lindian, if you have anything to add, I'll invite you to do so. If not, I will wrap up. And
sure, just really, really quickly, I wanted to remind folks that this conversation does not end with this meeting, and the same way that we got Arnaldo and Renee together, Denise and Gordon, I feel like you all have a lot to talk about as well. You know, Slack, that's what the Slack platform is there for. So in addition to you taking advantage of it, feel free to also talk about it with your networks as well, and get them to be involved, because the solidarity and the common causes that can only help to amplify your voices and also make your work a lot easier, right? So, you know, Slack is open for business.
There you go. We're open for business. Everyone have a wonderful Monday. Have a great week. And we look forward to seeing and hearing from you again. Take care, everyone. Bye.
Okay. Grateful.
Goodbye. Thank you so much.
Bye-bye. Thanks for having us.
It was our pleasure. Bye.